turns out that prior to the FDA approval, but after the phase 3 trial was positive, there was an interim period where individuals could get access to Radium-223 provided they fulfill basic criteria: pulmonary metastatic disease, symptomatic, no visceral mets. And I was the chair of that steering committee and presented the data here on 180 patients that were treated in the U.S. with radium, and we began to learn a little bit more about that particular effort. So what we presented were a couple of things. One is, in the context of the Alsimca trial, which was the phase 3 trial, we really did not have any experience with abiraterone or enzalutamide given concomitantly with the radium, and here in the expanded access we did. Turns out it's a safe combination, which is not a surprise, but it's important to be able to say that. We also found that if people had been on abiraterone and enzalutamide before they started radium, that the probability of their getting 5 to 6 cycles was greatly diminished. In other words, if you started using radium 3rd line or 4th line, then getting in the 6 cycles of radium that has been FDA approved and recommended was not really very probable. And what we did was then be able to look at things that were predictive of survival as well. And we found that those individuals who had 5 to 6 doses of the radium actually had a much longer survival than those who had only 1 to 4. Now, that last analysis is confounded, and I should explain that the people who got only 1 to 4 typically had a worse prognosis by higher PSA, higher alkaline phosphatase, etc., and were more likely to have failed prior therapies. So one of the lessons, I think, is that we ought not to be thinking about radium in the last line. We ought to be moving it up in the treatment sequence, and we can combine it with abiraterone and enzalutamide, and that can be safe. We also know that those people who do get it concomitantly with abiraterone and or enzalutamide as a frontline therapy have a very, very favorable prognosis, but of course that's going to require a randomized trial to determine if it's truly better.